I think of inclusion, I think of it in terms of two levels. One is the patient level inclusion, but also in terms of the workforce inclusion.
We must be able to tackle the needs of the most vulnerable in order to be able to say that we actually achieve health equity.
The biggest challenge is to have, and I'm going to speak for minority communities in general, to have trust in the research process. You know, that the research process is to be a benefit to them, not to take advantage of them and not to use them.
I think that when they have an opportunity to see that an organization has a more diverse and inclusive, leadership team, then that trickles down. You start to see people feeling more likely and trusting of the care that they're going to give.
Many times, the way trust is established is when you see somebody talking to you who's just like you. Whether it's the same gender or whether it's the same race and ethnicity,
A lot of times we find that the solutions are done without the end user in mind, without having that participatory piece. And as a result, the solutions are not what's needed or they're not used.
Being digitally savvy or enabling digital health in a health system might not be enough.
If anything that we learned is that their underserved populations are not being reached with our digital technology.
Some of the people, especially in rural areas or in low economic areas, they don't have technology. So trying to get the clinicians to say, if you really want to get to that population, you need to figure out, ask them how would they like to be, communicated with. Is it via phone? Is it a house visit or whatever?
In addition, I also think we need to figure out on the practice side how we can ensure that nurses have the resources and time to work on innovation.
The fact that we see more and more digital solutions being tailor-made for specific patient needs, I think that's definitely a step forward.
Right now, a lot of the nurses are doing this on their breaks, after hours, on the weekends, and that's not going to work. We have to figure out how to make that a part of a nursing workday, not only to advance nursing innovation, but we also know that that is a source of retention.
We should be changing policies. We should be changing, we need to be addressing from both government, private organizations and community levels, like that trifecta of making sure that we're addressing complex problems. And that requires diversity of thought.